Namaste.
Madam, namaste.
Welcome to all of you, and welcome to another session of AYUR Talks. We have with us today Dr. JAYANTI Ravi IAS, Principal Secretary of Health and Family Welfare, Gujarat. Welcome to you, ma'am.
Namaste.
It's a pleasure to have you again. Almost a year before, we had a similar discussion in the same forum when you had been one of the first persons to have started utilizing Ayush for the management of COVID pandemic. And we are proud to see you again here, and we are keen to know a lot of things which have happened in Gujarat during this past 1 year. And I know that it has been a very hectic year for you. So we will straight away go into the questions. Just before that, I have a formality to complete. I would like to thank Sri Guru Papeshwar and Sri Kotakal Ayurveda Shala, who had been sponsoring this event for us, and they had been sponsoring all our programs, and that has been, we are very thankful to them as well as to all the viewers who have been giving us a lot of support and sending us a lot of questions to ask, important people like you. I would like to ask you that, or know from you, how has, in your perspective, how has Ayush been utilized in the state of Gujarat for this pandemic, for the COVID-19 pandemic, in the entire spectrum, starting from the beginning in the first wave to this current situation?
I think didn't hear your question. Can you repeat it again? The audio was not clear.
How has Ayush been utilized in the past 1.5 years of COVID pandemic in Gujarat state, including the first wave and the second wave?
So, first of all, I want to really thank all of you for doing this wonderful initiative of sharing some of the best practices, some of the efforts rather. Whether they're best practices or not, time will tell. But I think with a lot of faith, a lot of us are putting in efforts. And I think it's very important that we have these conversations, these dialogues, and share whatever we are doing. So once again, I'm absolutely, it's a delight to be with all of you today and share almost a year later. So there's a lot that I think many forums, many people, many states have done. And Gujarat too has not been an exception to that. If anything, we take pride in the fact that under the leadership of our Honorable Chief Minister and the Deputy Chief Minister, who also happens to be our Health Minister, and our entire team. And I think the public too, Gujarat, there is a great deal of openness, receptivity to alternative systems, particularly Ayush, Ayurveda, homeopathy, etc. So we have followed this in a fairly systematic, organized way across the state, both in phase 1 and phase 2. If we look at the preventive interventions that we did in the first phase, Ukara, as it is called, also Amrit Pe Ukara. So nearly 12.9 crore doses of this was distributed across the state. And what we also take pride in is that it was not only something propelled and pushed by the state. We found that in a lot of cities, local community organizations, sarpanches, who are the Gram Panchayat leaders in many villages, they would make this early in the morning and then actually distribute it. I've also myself been a witness even in crowded cities like Surat, where in the early morning rounds, when I was camping there for about 11 days, we would go and find that people from houses would come with their little containers and take the ukala back home for their members of the family, and cutting across religious groups, cutting across linguistic groups. So what we found was there was a great acceptability. Similarly, Samsam Vatti, also nearly 10.08 crore tablets have been distributed. Another thing which is a homeopathic preparation, but which received a lot of support in terms of not only people willing to donate it, but also a large number of people who are willing to consume it. And we have success stories of village after village, where it's as if the entire village was fortified with that kind of protection because of this. We can talk of many villages in different parts. Nearly 6.78 crore doses of arsenicum album was given. And I must appreciate the elected representatives, our own team members, whether it's our Ayush doctors, NGOs, students, volunteers, sarpanches. So cutting across, their different backgrounds, differences, I think people really accept it. So breaking that mindset of probably having some kind of doubt as to whether Ayurveda would or Ayush would be useful. And more important, we were able to say that we've moved in the direction of making the mindset, what we in Gujarati refer to as man banana, or even in Hindi. So we were able to, I think, traverse that process of breaking the mindset to making the mindset of people accepting this, having faith, and it became something which got very accepted. This is the preventive measures. Similarly, in the quarantine centers too, we met with a lot of success. Ayurveda formulations were given to over 19,686 beneficiaries, and homeopathy too to a very large number of people. And out of these, there was hardly 100 patients in numbers, which comes to about 0.29%, who actually then got tested positive for it. The rest of them were all, they did not test positive for COVID. So that itself is, and then other than this, so we can divide it into three. One is the complete preventive, quarantine, which is, you can say it is like a quasi. There are people who were exposed to the infection and didn't contract it. And the third is curative intervention. So more than 16,000 patients who were taking treatment in our COVID hospitals were also administered Ayurveda or Ayush treatment as an add-on or an adjunct treatment. And we actually gave, this was also received very positively by a large number of them. And we find that those treated with Ayurveda were about, if we total all the hospitals in the third wave as well together, the number is even more, 24,613 who have been treated with Ayurveda-based interventions, while in the case of homeopathy interventions, if we include all the, and these locations span from the Ahmedabad city 1,200-bed hospital to Sola Hospital, to hospitals in Rajpipla, Surat, Vyara, Chota Udaipur, Sabarkantha. So what I'm saying is it's a very diverse geographical spread. And Ayurveda, nearly 7,164 of the patients who were taking standard treatment, allopathic, were also given this adjunct treatment. And out of this, we found that only 0.33% in the case of homeopathy showed worsening of symptoms while they were taking the traditional allopathic medicine, and this, which means that 99.67% of them actually improved. And we also have a study which I would like to share shortly about the decrease in duration of stay between a control group and a group which was given this. And similarly, in the case of Ayurveda too, about 0.68% were those whose condition deteriorated, 167 of them, which means 99.32% improved after this adjunct treatment. So all these, I think, are very, very overwhelming evidences in support of the fact that Ayush has worked, and there has been a great acceptability. So we are very happy that while COVID has brought a lot of, shall I say, disruptive changes, I think one positive spin-off has been that people's faith in Indian systems of medicine, particularly Ayurveda and homeopathy, the Ayush tradition, and improving their lifestyle, it has definitely given a boost to that. So we must acknowledge that change which has happened in the BC, before COVID times, and post-COVID times. So that is one palpable difference that we see.
Thank you, ma'am. Thank you for this big, good overview. Could I request Pavanji to ask the next question to ma'am?
Ma'am, thanks for your wonderful overview over the past 1 year. What has happened? Lots of water has flown down the Sabarmati. Recently, ma'am, there was a letter by Secretary Ayush to co-opt the Ayush infrastructure into the mainstreaming of health services. So the numbers you have already told us that the Gujarat model probably might have inspired Secretary, built in confidence to write the letter. The 24,000 plus number is a huge number. But what about the Ayush infrastructure? How it was co-opted, and what is the present position? Please, ma'am.
So I would say that we absolutely, Vaid Rajesh Kotecha ji is from our state. We take pride in the fact that he was Vice Chancellor of a university which has today become an institute of national importance. So that is again a very big the transformation that has happened in this interim time during the COVID times. It's perhaps the first institution in the Ayush category to be at that level, an institute of INI as it is called. And he was the vice chancellor here, and we've been getting all the support, inspiration from him and his entire team, and of course all the people here. So while we did respond very proactively once we got the letter, but we also take pride in the fact that even prior to the letter, health center, and also installed a PSA, pressure swing absorption oxygen plants, were also, that has been installed to cater to about 85 patients. And there again, the purpose was to also reduce the burden on the civil hospital Gandhinagar, the GMERS hospital, which was a COVID hospital. So this came up as a facility to supplement it, and there we have already deployed all these Ayush methods of treating in addition to the traditional methods of treating, standard treatment protocols, and also a very large number of Ayush medical officers, Ayush paramedical staff have also been inducted for COVID duty right from the phase 1, both for the preventive, the Dhanvantri Rats that we have had in a very large number across the state, which is a very nice synthesis. Not only do we go there and give medicines for the non-communicable diseases and also do testing, rapid antigen test kits are taken there, and then do a surveillance screening of people who have various illnesses, even malaria treatment, etc., slides, etc., medicines. All that is also happening. But parallelly, we're also giving them the Ayurveda and homeopathy, the Ayush medicines. So I think these are some of the initiatives. And as I mentioned, we have a very large number of hospitals, which I just shared with you. In all, the total beds that we can say is about nearly 496 beds, which were run by our Ayush hospitals. And these also spanned across different areas, and with OPD, and many of them were CCCs, which is a COVID care center, but many of them were also converted into COVID health centers, and a few were also dedicated COVID hospitals. So we've had all the three types of facilities running in these. And additionally, as I said, in the traditional strict dedicated COVID hospitals too, one major breakthrough success has been, we have been able to cross the threshold of those hospitals, and the Ayush treatments have found their entry there, acceptability there, and there are some very interesting results also that we would like to share.
Please share, ma'am. We are very eagerly.
So this is just, it is like this. Fresh, just about published. So we want to share with you that if we look at the interventions, one of the things that we did in these, this was our own director Ayush, we called it the Efficacy of an Ayurveda management as a supportive therapy in SARS-CoV-2 mild positive patients. We wanted to check how efficacious this is, and so it was an evaluation of this. And we found that with this intervention, the cases, if you looked at the standard treatment protocol, as we call it, the standard treatment protocol given to an STG, a standard treatment group, and the add-on or the Ayurveda treatment group, which meant it was an add-on over there. If you look at the average relief in days, because that's a quantifiable way. So in the case of fever, while for the standard the average relief, they got it in about 5.54 days, whereas in the case of Ayurveda, it was 3.95 days. So the improvement in terms of absolute number was about 1.59 days when you cumulatively calculate this for all of them. Percentage is about 28.7. Similarly, for sore throat, there was a 31.8% improvement, cough 17.3, dyspnea also 23.6, running nose 40, general malaise and weakness 38.9, headache 16, and nausea has been dramatic, very significant 82.8% improvement. So all of these go to show that we enrolled a fairly good number of patients in both groups, at least a good number, and then when they were put through these treatments, we found this palpable improvement. So this is also something that gives us a lot of confidence. that these are working. In addition, we were also a part of the Ayush 64 trial. Our own Ayurvedic University was a part of it, and I think that's one of the best studies with ICMR protocols, etc. So that has also gone a long way in reinforcing our faith and actually demonstrating in a very scientific way the efficacy of the Ayush methods of treatment.
Great, ma'am. It's such gratifying things to hear from you. The experience you have shared, all the figures and all the data. May I request you to pen this down and write it as an editorial for one of the journals run by Ayurvedic institutes. National Institute will be glad, very proud to have your write up as an editorial forum. I invite you. It's such a gratifying experience, sir, to share with the
and I think
larger
credit
readers.
goes. No, absolutely, it'd be a pleasure, and the credit goes to our entire team. So we have the director of Ayush also, and then the principal investigators in this were Ved Falgun Patel, Ved Surendra Soni, and other people. So I think it would go to strengthen their.
Not just this paper, the total experience, what Geeta ji asked you, the 1.5 year experience, hands-on experience to mitigate COVID. That will be such a wonderful thing to hear from you. Geeta ji, your turn to ask.
In fact, I would also like to see one of your columns in a national newspaper, ma'am, like in a commentary or an editorial or an opinion page. I think this should go in as an opinion where Ayush is properly supported with evidence. That's a huge advantage to it. So with that, I would like to, because you seem to be now as good as a doctor of medicine. I know that you are a doctor of in management studies, and you are a nuclear physicist, and most of the nuclear physicists and physicists seem to somehow love Ayurveda. So you are also one of that. So thanks for that. But I would like to know where do you think in the picture, if again a pandemic like this comes, where do you think you will plug in the Ayush system? If you are again faced like in a renewed wave of or a new pandemic comes up, let us say 10 years later, where do you plug Ayush systems into the management of such a pandemic? And also, like, how this integrated system, or what do you think about an integrated system and how it would be, organized, or how it would be rolled out?
Well, to answer your question, I think the first thing is if there were a second installment of this, what we now refer to as a third wave. So we are certainly, as we speak today, I think an hour ago, we had a meeting with all our collectors, all the municipal commissioners, district development officers, and their teams. So the chief district health officers, CDMOs, etc. Because 2 days back, we are all putting together our plans to be in preparedness for the third wave. It is always we hoping for the best, and we're hoping that with all the preventive work that we're really able to flatten the curve. But we should also be fully prepared for a surge if it happens. So in that context, one of the key activities has been the preventive aspect, in which, while we're talking about vaccination, the pharmaceutical and the non-pharmaceutical, where we're all familiar with the SMS and ventilation, etc. But along with it, Ayush has also been given a lot of a pride of place in all those efforts. So we're trying to push Ayush in a big way because of the acceptability also of the public and the efficacy that we've seen. So that is, so we wouldn't only wait for the third wave or the pandemic, but I think while we're doing this preparation right now, I must also add that Gujarat has taken a lead nearly 3 years ago in something unique known as Samanvay project. Samanvay word itself means an integration. So what we did is the Ayushman Bharat health and wellness centers, which are basically nothing but the sub-health centers, which were converted with 12 different dimensions of treatment, ranging from not only maternal child health, which was initially the mainstay, but also other areas, including NCDs and so on. We decided to bring in and dovetail Ayush treatment methodologies also into it, and give people this choice of choosing, because we do understand that there are certain emergency situations, maybe a trauma or something that suddenly happens, where you may not have the luxury of waiting for Ayush. You need to immediately intervene, and maybe allopathy would be certainly the preferred choice and ought to be we agree. But there are certain conditions of a more chronic nature where you want to go to the root cause rather than just managing the symptomatic management of the condition, where there is a lot of faith and there's a lot of not just faith, but there is also evidence to show that Ayush works better. So we've worked this together with a bunch of our colleges. We started it as a pilot, and I'm very happy to share today that across all our health and wellness centers, numbering nearly 5,000 across the state, we have the community health officers either drawn from Ayush doctors or from nurses. Both of them are open, eligible to be appointed as community health officer in these uh, Ayushman Bharat health and wellness centers. But as a part of their training, we've included a 21-day module expressly dedicated, devoted to this project Samanvay. So for each of the 12 different areas that they're supposed to provide treatment, we're giving them various inputs from Ayush, for which we collaborated with a large number of our experts, and particularly a college which was established by none other than Sardar Vallabhbhai Patel, one of the oldest colleges in Gujarat, which is the KS College of Ayurveda in Nadiyad. Gupta ji is the principal of it, and so they have a lot of collaborative work with Germany and other places. So what we found interesting was that dovetailing the two, even our hardcore doctors and other people, those from the medical fraternity, the conventional ones, are also now a little more open to it. So I think while we would certainly be fully prepared for leveraging Ayush if and when the third wave happens. But I think we are now very keen on not only augmenting and sustaining what has happened in our health and wellness centers, but also accelerating it, and then now moving it to further steps, namely not only the sub centers but the primary health centers, the CHCs, community health centers, and also the district, sub-district, district hospitals, and the tertiary quaternary facilities, including medical colleges. And ideally, I feel we should also include some of this curriculum in the MBBS course, while I'm not sure how that would be immediately possible. But I think it's very important to have a very well-rounded, a more enlightened view of what is it that these different systems offer, because it's good to learn this right at the beginning when you're getting sculpted as a young doctor. So these are some of the things we are doing. And I think COVID has been a watershed time. As I mentioned, before COVID, there was a lot of resistance. Of course, we had started this effort even before COVID. It was started on October 2nd, 2018, if I remember right. And it has had some maturity. It has taken some years. It is well established now, and we want to really sustain it, accelerate it, and further innovate and take it further.
Thank you very much, ma'am. Pawanji, please ask the next question.
Ma'am, wonderful actionable insight for the one nation, one healthcare system policy, and then the integration of National Health Policy 2017 and National Education Policy of 2020. But ma'am, wonderful for the integration aspect. We would definitely like to come back to you on that point again to elaborate it further. But before that, one pertinent question is raising in my mind that third wave is yet to come, but certain opportunistic infections are already there, especially this mucormycosis, the fungal infections and all other non-typical, atypical manifestations of COVID. So anything in your experience where Ayurveda has helped, because Telangana government has especially written a letter to manage mucormycosis, Ayurvedic interventions. Anything in Gujarat model for such opportunity?
Well, I must confess that we have not specifically done anything in terms of this post-COVID sequelae, whether it is mucormycosis or even the multi-system inflammation syndrome or such other cases. However, one of the things we can mention that we have done is that with the physiotherapy colleges, post-COVID physiotherapy, because a lot of it is about getting the lungs back into action, because portions of your lungs have become almost irreversibly, they've got damaged. And so the only way probably is to revive them and rejuvenate them using yoga and different systems that we have in the alternative systems, Ayush systems. And also, in a way, the reason COVID times we are finding some of these useful indirectly also is that COVID has been particularly harsh, if I may use the word, in terms of morbidity and mortality on people who have a lot of NCDs, those cases with comorbid conditions, people, particularly those who have a lot more obesity, people with very high uncontrolled sugar, even mucormycosis. These are all instances where this is found to be a little more pronounced. And therefore, so these are also, we can go back to the root and say that these are what are clubbed also as lifestyle disorders. And also sometimes the consequence of this is also the mental condition, even in COVID wards. We find that a lot of patients, sometimes this very question of, when you're in this kind of a situation, they start fretting, and this itself, the mental condition, further aggravates and precipitates their situation. So for all of this, I think Ayush has a more wholesome, holistic adjunct. I'm not talking of completely leaving the traditional or the allopathic line of treatment, traditional as the conventional, currently conventional method, not leaving it, but along with it, if we can put this in, I think it makes people also feel good. And I think this feeling good and this psychosomatic, a lot of illnesses also have the cure of it is also hinged over there. So if we can combine the two, and if lifestyle is given due importance, then I think all these problems like obesity, blood pressure, etc., can be mitigated, minimized if these are practiced. And so I do see this connection. But in terms of mucor, specifically mucormycosis, we have got some inputs from some of our experts that practices like Nasya, some of these hygiene, like the spulling that they say, oil that you keep in the mouth, etc., may improve your oral hygiene. Nasya may improve the sinuses, the situation. But we had tried out Nasya in some pockets in Rajkot as well last year. Rajkot Municipal Corporation as a part of the prophylaxis, the preventive, as a part of the Dhanvantri Rath. But we have not yet done a formal study to see the correlation or any impact of these practices on mitigating mucor or preventing mucor. But we would be very happy to explore that area as well.
Madam, if you can, please let us know more about this physiotherapy for the rehabilitation, which is a very interesting thing, just going beyond what is being practiced right now. It will be wonderful to hear from you.
Right. What we will do is, this happened, if I remember right, sometime around September of last year. We inaugurated, the curriculum for it was developed by one of our, we have a pulmonologist called Dr. Tushar Patel, who's also a member of our state task force. He took the lead in it, and we had principals of various physiotherapy colleges also connected, and they worked on putting together a curriculum, and it was launched by the Honorable Chief Minister and Honorable Deputy Chief Minister across these colleges. And the idea was that we have a large number of physiotherapy students who have passed, or those, physiotherapists or physiotherapy students. So if the post-COVID people who are at home, it also opens up a small window of livelihood for the physiotherapists to go and provide this treatment once they have recovered, once the infectious part of the phase of the disease is over. And simultaneously, it also helps people, because a lot of them complain of fatigue, breathlessness, even after COVID, and a lot of complications. So if the lungs, capacity of the lungs, so even in using this the simple device, I think it's called a spirograph, or where you blow into it, etc., so that the lungs capacity can increase. And also simple things like Omkar, and then the simple exercises of practicing some notes, etc., singing, may also give your lungs that capacity to hold more air and more oxygen. So these are some of the things, but I'll be very happy to share the curriculum and a small note on it at a suitable time.
Good. Thanks, ma'am. Geeta ji.
Thank you. It is really wonderful to hear from you about the different aspects of medical system that you have brought into for the care of COVID. One small question, or maybe very important question, ma'am. How do you think, or what do you think are the major bottlenecks in integration of, like if you want to post COVID, when you are deciding to bring Ayush systems into mainstream in a more effective manner, so that it can be utilized in a much better manner in future. What do you think are the bottlenecks, and how do we overcome that?
Okay, so when we did this, what we find is that while we were able to, I think as we say, there's this word carpe diem or seize the day. So this time COVID gave us that opportunity to seize the situation to actually allow it. Otherwise, till then, while you do want Ayush also, I think this thing of harmoniously having both systems coexist and giving the choice to patients, an informed choice, and not completely stopping one in favor of the other or vice versa. That's not the purpose. I think it should be a very balanced choice that people can exercise and choose. So while that was very difficult earlier on, even during the time of what we now refer to as seasonal flu or swine flu. I remember we used to have several marathon sessions, even at the level of the minister, where we were trying to get both the groups, make them sit together, the alternative medicine group on one side and the allopathy is on the other side. It would almost seem like a very, very ready to fight with each other, very polarized, fanatic group on either side. But this time I was pleasantly happy that sometimes there is that little sweet spot of time when there is a readiness, willingness for things to germinate, acceptability. That did happen. So I think the fact that they were allowed into the wards and the fact that people accepted and the fact that these palpable, significant improvements have actually been documented is a good shot in the arm. However, I think some of the bottleneck issues here are that when we have these herbal drugs, there is still, in terms of quality control, standardization, we probably need to do a little more work collectively, all of us together. There are standards, there are methods, but I think it's better to do a little more. Also dosages, because this kind of codification, if we can have, I don't know, a full encyclopedia of pharmacology for the Ayurveda, I'm not sure if it exists, but if there can be some kind of a documentation coding for different things, for different compositions, different types of bodies, these are for the weight of the body, these are the dosages. If there can be some kind of a common minimal mutual agreement by some of the top scientists of Ayush, that also will lend a lot more, shall I say, belief. It'll lend a lot more credibility to the whole thing. Similarly, randomization, and when you talk of really these good studies with a control group, randomized control trial, etc., that needs a lot more rigor, which perhaps is missing in terms of the Ayurveda system of education now. So maybe if we can inculcate some of these methods of research, even in the undergrad and postgraduate students, both in the MBBS side and the Ayush side, and get them to collaborate. Like very recently, I was talking to somebody who graduated from Banaras Hindu University. So, of course, she happens to be a lady who graduated several years ago, perhaps in the 80s. But she was mentioning that there was a lot of emphasis both on the Ayush methodology there as well as the allopath. So in the hostels and dinner tables, when they would all interact, I think the exchange of ideas, that faith in each other. So I think this sort of thing, if we have students coming to the medical education MBBS colleges from Ayush and doing one semester here and vice versa. So, and that will happen if you really have Ayush colleges also getting accredited, maybe A-grade colleges. If the quality really improves, I think everybody, we see this happening world over. I mean, why is it that in Europe and other countries, you have allopathy doctors wanting to come and learn alternative medicines to be able to fold it and plow it back into their own system? We should make these pathways of learning open here as well. Similarly, I think the number of patients, also sometimes this willingness. So when all this happens slowly, we are, I think, getting more and more, we are entering this territory of getting more and more acceptability. So patients, inducting patients, getting willing for statistical significance, etc., is also sometimes a challenge. So that is there. And also, you see, a lot of these Ayurvedic medicines have pungent tastes, smells, and they have certain things which are very characteristic. So if you have to develop a placebo for a control group which has similar properties, that also calls for some attention, some care. So some of these nuanced things require time. And also the duration, unlike allopathic interventions, which are generally faster, you just have to administer certain medicines. Sometimes the duration of treatment in the Ayush methodology spans several months, perhaps sometimes even running into a few years for conditions for which allopathy may not even have a cure. But so whether people have that patience to really endure it for a long time and be open to study. So these are some of the bottlenecks, but they're certainly not impossible bottlenecks. But if we all apply our collective wisdom, intelligence, and see how to solve and crack these problems, I think we should be able to do it.
Thank you. I think it is a fairly wide area of bottlenecks, but not so bottlenecks. So they are simple, or probably if you think properly and act, I think we should be able to overcome that. And I think that would be a lot of responsibility for policymakers and decision makers like you to help Ayush systems to reach that level. Thank you, ma'am. Pawanji, please ask the next question.
Ma'am, you mentioned the robustness of investigative and research methodology procedures. So one such study was done under your guidance at Jamnagar Institute, you mentioned, with medical college, the Ayush 64 as a add-on to standard of care. And now it has attained such a cult status that task force has also recommended, and Ayush ministry has rolled out a doorstep delivery, something sort of that, Ayush 64 to home care quarantine patients. So what is your take on that? How patients have received that Ayush 64 Abhiyan, what we prefer to call?
So the Ayush 64 Abhiyan, I must say, it has been very well received here. This is basically, I think it's got 4 different herbs which are mixed into it, and then the efficacy of it has been very good. So what we did is in Gujarat, even I'm very happy to share that very recently we had the Honorable Prime Minister. He had visited Gujarat as a part of following the cyclone that we had, Tokte cyclone, as a part of his immediate visit following that. So as a part of it, there was a presentation also related to the COVID preparation and work. So during that, he too very proactively, talked about Ayush 64 and the need to, make it available at the doorstep of people. And Gujarat has done something in that direction, which I'm very proud of. We felt that a lot of times in rural areas, where earlier on in the first wave, the disease was more spread in the urban areas where the density of population was high. But this time we saw different presentation. We saw that in addition to the municipal corporations, whether it's Ahmedabad, Surat, Rajkot, Vadodara, and so on, we also found that the disease was spreading in the rural areas, which was a little disturbing. And it was further getting a little, exacerbated by another fact that people were not coming for testing. They would initially think it's a simple cold, it's a simple fever. And the fear of having to go to get admitted, they thought the minute if I go for a test, if I'm positive, I'll be pushed and into a Kana Pani kind of, hospital, because in rural areas, there is still that little bit of fear. It'll be a COVID hospital and my relatives, because you don't allow attendants of the family to accompany them. So this tendency to hide it or not be willing to come. So we felt that, and therefore cases were increasing. And so there were some of the districts where we felt the positivity in certain villages were at one point of time as high as 20%. So then as we were thinking of what could be done, we came across a very simple but a very powerful idea, and the Honorable Chief Minister and Honorable Governor of Gujarat launched it on the 1st of May. So it's called Marugam Corona Mukt Gam. It's a very simple idea. Mera Gaon, Corona Mukt Gram. My village, Corona Free Village, or ward. Similarly for city areas, that's a newer development. So what we're doing in that is there is something called a symptomatic, that is a suspect isolation. So you're not waiting for testing to be done, but you do a surveillance. Anyone who has any of these minor symptoms, you isolate them right there within the village. So we've set up these Corona COVID care centers, CCC. It could be in a Samaj Badi, which means a small facility in the village. It could be a school. And we have some beautiful pictures of it. I'll be happy to share. Basic facilities which are neat, which are clean. So we have that running today in 15,312 such community COVID care centers are running in our villages, across the villages of Gujarat. We've done it in collaboration with the Rural Development Department and the Panchayats Department, where about 6,325 cases are admitted. So this, the mantra here is suspected isolation to break the chain, and presumptive treatment. The logic was simple. Even if you test a person, the person is positive or negative, what is it that you do after that? You basically start with paracetamol or crocin. So without waiting for the test and wasting that much of time and allowing the person to move around and infect a host of people, the idea was you immediately break the chain, convince them, work with them, motivate them to get isolated. And over there, you start this treatment basically of paracetamol. But additionally, although there may not be very significant solid evidence in favor of it, but vitamin C, zinc, other things, and then basic things like even budesonide, at least the inhalation, nasya, as we say, nas, lena, steaming. So all these basic things with food, rest, prone, lying on the belly, which is again, they say, dramatically improves your the oxygen saturation, and also using pulse oximeters to constantly measure their temperature, the oxygen saturation, and thermometers to measure. So temperature, all this was being done now across. So over there, we have added these Ayush 64 tablets as well. So we have given as many as 10, 100,000 of Ayush 64 tablets to these, and we've placed another order of about 1 crore tablets. So the idea is, if you give this at the right at the initial stages, you can it appears very clear that you will not need to, the condition will not deteriorate or get escalated, that you need oxygen or you would need ICU beds. So along with this basic intervention of a simple crocin, paracetamol, and other things that we're giving, we're also giving Ayush 64, and it has been now very nicely, it is getting accepted across these COVID care centers. So we're very happy with this. This has just started from 1st of May across the state, and now the distribution of Ayush 64 is also going on, and all the districts have shown a lot of acceptance, readiness, eagerness to take this forward.
Huge numbers, ma'am. Huge. It was such a wonderful talk from you, mesmerizing. I would again reiterate that we would request your editorial piece, a thought article. I know that you have a meeting scheduled just 15 minutes from now. So, Geeta ji, your turn for the question.
Oh, no, I think I don't have much questions to ask, but it is huge numbers, ma'am. 12 crore patients who had been given Ayurvedic medicine, 6 crore people who had been given homeopathic medicine, 16,000.
It may not be 6 crore people, it will be 6 crore doses.
6 crore doses. Okay. Okay. But still, it should be not more than, if you reduce the vitamin, it is coming to something around, if you give 10 doses to one person, still it is around 60 lakh people. It's a huge number. So the numbers are quite huge, and the kind of results you have shown, especially with the ideas like this Corona Mukt Gav and Corona Mukt, wards, 16,000 of them. I think numbers speak quite a lot on what you have done, and it's a great work. We don't want to we would like to keep you here for another 1 hour and ask you more and more questions, but we know that you have a lot of work to do, and you are doing a lot of service to the country and to the people of the state. We are proud of you, ma'am, and we hope that we will be able to speak to you more at leisure at the end of the pandemic to find out how you would see the entire picture, because we have taken it in the beginning, we are now taking it in the middle, hopefully in the end of it, but probably we are in the middle. But then we would also like to come back to you and speak to you at the end of it. With this, we are very thankful to you for having spent your time, and very precious time that too. And we are also thankful to our sponsors, the Sri Dut Papeshwar and Kottakkal Ayurveda Shala, for having supported us in creating this program, and thanks for all the viewers who have supported us.
This is it's a privilege to share all of this with all of you, and we would really look forward to more volunteers. So this time, one of the things we are planning for the third wave is, just as you have a state disaster relief force, SDRF, we have planned to have a state health reserve force. We want more and more volunteers, people who want to come work both on the preventive aspect and especially in Ayush too. If we can have more and more ideas, so we would be very happy. And again, it's a very humbling experience to sit with all of you who have done so much of work, devoted your lives to Ayush, to the cause of Ayush. And I feel very privileged that we have an excellent team. And I happen to be sitting at this point of time in a position where I'm in a very small way able to carry my team along and give them little support and see what difference we can make. Thank you very much. Namaste.
Thank you.
Namaste. Congratulations and best wishes to you and your